What's up, guys? It's your girl Maze here. I hope you are having an amazing day. I know it's been a while since I've made my last YouTube video, so I'm off today, or should I say off tonight, because the route that I've been on has been running at night. You know, going in, you might say 11 o'clock at night. So I'm off today because I had a doctor's appointment to do a ultrasound and a transvaginal ultrasound to get an update on my fibroids, because we are nearing that time to do IVF treatments. I have an appointment with them, I think next Wednesday. I think it falls on that, but it's July 2nd, to go over my medications, the administering them, and how often, and the schedule, and all that good stuff. The education part of, well, I don't know. You might know, you might not know. But yeah, so we're about there. It's right around the corner. I'm excited and nervous at the same time. My biggest fear with doing IVF is that it doesn't take the first time. And that's just something that comes with it. You know, it could take the first time, but possible miscarry later on down the line. So prayers to me and my husband that we can get fortunate and just have to do it once. My best friend, my sister, she is far along in her journey, and she has, I believe, 2 more weeks until she gets induced, because she's a few years younger than me. So anything over age 35 puts you at high risk pregnancy, geriatric pregnancy, which sounds crazy. Makes you sound older than what you actually are, but hey, it is what it is. Now, I did do some research on some of the possible issues that I might incur due to my current health issues, which I have PCOS, fibroids, and high blood pressure. So I did have my appointment, I think it was in May. Yeah, it was in May for the maternal fetal medicine, which specializes in high risk pregnancy, which I am. So they covered over some things with me. And in my last video that I made, I said that I would be going over those issues and what to expect. Now, due to my crazy hectic work schedule, I wasn't able, after I did the research, I got my notepad here, but after I did my research, I wasn't able to read over them, so that way I can just kind of, use these as notes as I'm explaining everything. So, because I really didn't want to be reading off of paper, but really don't have no choice, and also wanted to study the information a little bit further. So I guess I will kind of be doing that here as I'm reading over things to expect, because I'm gonna do it in sections. So this video is going to be talking about the risk that is involved with having PCOS during pregnancy. And please forgive me. I will be reading off of paper, but hey, it is what it is. My work schedule is crazy. I'm just happy to finally be able to do these videos. So I'll have a few more coming, talking about the high risk, the issues that may come along that I may face during my pregnancy. Because okay, my brain is tired. Please forgive me. I got off work this morning. It is currently 2:11 Central Time, and I got off work this morning right about 9 a.m. and they sent me for a random drug test, which is cool. I'm not worried about it. But it's just like, damn, y'all are cutting into what I had planned today on my off day or night. But good thing I am off tonight, because things that I had planned to do before my doctor's appointment, I just gotta start doing it now and hope that I can get as much done today, because I have some other things online to deal with and some stuff around the house to get done and some packages to open. Oh yeah, and I'll probably be making a video about that. I'm starting my Barbie collection. Yes. Okay. So, again, excuse me. Okay, so I'm Maze. I am 40. I'll be 41 next month, July 29th. Me and my husband has been together for 7 years. This year will be, we'll be married 3 out of those 7 years. We got married on our fourth year anniversary. So, and another rundown, he do have 2 kids. He has a boy. He'll be 15 in August, and his daughter will be 13 in December. So we're working on trying to give them a little brother and sister. And I know, you know, my stepdaughter, she don't think she's gonna be excited about it, but I see how she is with my other baby cousins and niece and nephews, and she say one thing, but I think I'm gonna be having to fight this girl over my own child. So anywho, so this video I'm gonna go over sorry I keep saying it. Like I said, my brain is tired. This would be about PCOS while being pregnant in my age, which I believe anyone who deals with PCOS at any age getting pregnant will deal with these issues. And again, sorry that I'm reading off paper. I haven't had a chance to go back through it to be able to, you know, say it right off the top of my head. Okay, so I went to Mayo Clinic. Well, actually, I Googled it, and I've been getting all my information off of mayoclinic.org. I did want to check a few other resources, but due to being pressed for time, I just kind of stuck with Mayo Clinic. I do use Mayo Clinic, you know, for other research and medications and just, you know, information that I'm looking for that I might need. All right, so let's get into it. Make this short, sweet, and as painless as possible. And before we get started, yes, this channel is fairly new. So if you could, please like this video, give it a thumbs up, and subscribe to my channel, because I will be covering as much of my IVF journey as I can. But outside of that I will also be, you know, just talking about my personal life and telling stories and doing some gardening and who else knows, my personal YouTube channel. So yes, please hit that subscribe button, hit that thumbs up now or at the end of the video, but just please make sure you do it. All right, PCOS. I hate that I gotta read it from paper, but anywho, PCOS. Higher risk for pregnancy complications that include miscarriage, gestational diabetes, and preeclampsia. And I can't recall if I do. I think I do hit on that in here, but those are something else I want to do further research on. Okay, so, and PCOS also can cause you to, you have to do preterm birth. That rate of having to do deliver preterm, that risk is a lot higher. I know the maternal fetal medicine doctor did say they're gonna take me at, I can't remember. I know I'm not gonna carry full term, so I believe she said 37, 8 or 9 weeks, somewhere in there. Okay, gestational diabetes. That is a condition that causes high blood sugar during pregnancy that can affect your pregnancy and your baby's health. Sounds scary, but it's very well manageable, you know, through, of course, as I always say, diet and exercise. So I'll be facing that. That would be a risk that I'll be dealing with. And pretty much what that is, generally your blood sugar returns to its usual level soon after delivery. So, which I've watched a lot of shows that talked about that, and it's just pretty much having diabetes while you're pregnant. Now, I'm not sure exactly like the details of the science behind it, why that is caused during pregnancy, you know, because I'm not diabetic. I do have diabetes that run in my family, more so on my father's side, I believe. But so I may be dealing with gestational diabetes. Let's just hope that's not the case. I already been trying to practice better eating habits. That's definitely rough. You know, I've been working on bettering my eating habits for, oh my gosh, well over several years. So, all right, anywho, it's PCOS. A higher risk of getting type 2 diabetes is when the body cells don't respond properly to insulin. The pancreas may not produce enough insulin. That's type 2 diabetes. Type 1 diabetes is an autoimmune disease where the body's immune system attacks the insulin producing cells in the pancreas, which needs injections to manage blood sugar. So type 2, usually, like I think my dad has type 2. He did have type 1 because he did have to take insulin shots. And I believe, apparently, it got better. And now he just had to start taking a pill for it. So I guess I want to avoid both of them. But definitely type 1 diabetes. I want to avoid those. I'm not the ideal person to be able to inject myself. So this IVF treatment is definitely going to be a task for me, but I'm going to keep at hand the end game and the end goal, and I'll be able to do it. I know once I have this appointment to go over everything, I got faith and belief that I will be able to do it. I can do this. All right. And let's see. Various hormones work to keep blood sugar levels in check. During pregnancy, hormone levels change, making it harder for the body to process, if I can get it out, blood sugar efficiently, which make the blood sugar rise. So I guess that kind of answered the previous question on exactly what happens. Why do you have gestational diabetes? So that kind of answers that a little bit. You know, the body just changes, of course. All right. PCOS, gestational diabetes, complications that may increase risk for baby. All right. Excessive birth weight. Blood sugar higher than standard range can cause your baby to grow too large, 9 pounds or more. Golly. Yes, more likely to be wedged in birth canal, having birth injuries, or need C-section, which the maternal fetal medicine doctor did tell me that it's very possible that I will have a C-section. No, this is what she said. They're right about 37, 38 weeks. If the baby doesn't come on its own, that they will have to induce me and give it a couple days. And if it doesn't, they'll have to do C-section. She said, however, if my body is responding well, they'll kind of just let my body do it on its own. But if I start having, you know, elevated numbers and stuff, that they will have to go in there and take the baby. C-section. Also, PCOS, early birth, which is preterm. High blood sugar may increase risk of early labor and delivery before due date, or early delivery may be recommended because of a large baby. So that's interesting that having PCOS, I don't know if that, would you say that having a large baby is at risk? I mean, I guess it could be. Maybe not. I guess it's 50-50. But yeah, at least it'll be a good sized baby. Okay. Serious breathing difficulties. And these are complications at risk for the baby. So you got excessive birth weight, preterm birth, serious breathing difficulties. Babies born early may experience respiratory distress syndrome, a condition that makes breathing difficult. Let's pray to God that that don't happen. So I'm glad that I am doing the research so I can get a better understanding on what to expect. So if something do occur, I won't be like freaking out. I'll be like, okay, well, they told me that this is possible to happen. And yeah, I hope my baby don't have asthma. I don't know if that can cause it or not. Don't know. We'll find out. I have asthma. I was born with it. I still have it. It's a hell of a lot more manageable, you know, since I was a little girl. When I was a little girl, man, I couldn't go outside. Like the apartments we lived in, when they cut grass, I could not go outside the day of or the day after because it would cause me, my allergies to act up like really bad, doing all of that and all, you know, all of that, all that stuff. And it would cause me breathing difficulties. So I pray that that is not the case for the baby. All right. Also, where are we at? Where are we at? Also, other complications for the baby is low blood sugar, hypoglycemia. Sometimes babies have a low blood sugar shortly after birth. Severe episodes of hypoglycemia may cause seizures in the baby. Prompt feedings and sometimes an intravenous, I think I'm saying that right, glucose solution can return the baby's blood sugar level to normal. Obesity and type 2 diabetes later in life, that's a trip. So PCOS, if it does cause issues like that, my baby could be facing obesity and type 2 diabetes later in life. Like, that's a trip how the body works, ain't it? Babies have higher risk of developing obesity and type 2 diabetes later in life. That's wild. Stillbirth. Let's pray. Pray to God that it's not the case. I know everything will be okay. I got faith and trust in the Lord that we will carry full term into a live birth. Amen. Okay, stillbirth. Untreated gestational diabetes can result in a baby's death either before or shortly after birth. We're going to pray that everything turns out well for me and baby. Yes, 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 yes. Complications that may affect me. High blood pressure, which I already have high blood pressure, so I'm curious how they go hand in hand. I'm gonna definitely most likely be on a strict diet. I'm gonna have to kick it up a whole notch to get ahead of the game. Gestational diabetes raises your risk of high blood pressure as well as preeclampsia, a serious condition of pregnancy that causes high blood pressure and other symptoms that can threaten both your life and your baby's life. Another effect for the mama, having a surgical delivery, C-section, future diabetes. So me getting pregnant with PCOS can possibly cause me to carry on with diabetes. So it's not just that gestational during birth, I may be at risk afterwards. But I got trust and belief that I will be okay. Me and baby gonna be okay. Okay, so we have prevention. No guarantees to preventing gestational diabetes, but the more healthier habits you adapt before, the better. Eat healthy foods. Choose foods high in fiber, low in fat and calories. Focus on fruits and vegetables, which I'm already there. I love me some fruits and vegetables. I'll probably just gotta lay off the red meat a little bit more. And also whole grains. Strive for varieties to help achieve your goal without compromising taste or nutrition. Watch portion size. You know what? I'm curious if that. Will I have to watch portion size? I'm gonna have to look that up. Yeah, hold on. Let me look that up. Because I'm curious if I'm having to watch portion size. Will that be before or after pregnancy? Because pregnancy, naturally your body is feeding too. So you eat more. I'm gonna have to ask. Yeah, I made a note of it. I'm gonna have to ask the doctor that. It also says start pregnancy at a healthy weight. Lose extra weight beforehand for a healthier pregnancy. Technically, due to my height, I am overweight. I wouldn't say I'm obese. I'm just super thick. I got a little bit on the midsection, but I'm just super thick. One of the last doctor's appointments I had, I weighed in at 181, and I'm 5'3". Well, 5'2.5", but I can go either way. So I'm gonna stick with 5'3". You don't know nothing no different. 5'3" I am. Keep active, which isn't that big of a problem for me. I do like to stay active and do, physical activities. However, I'm not as active as what I used to. Oh, speaking of, I was supposed to have went up and checked on that gym membership. I might have to catch them another time. Damn, and it was right down the street from my doctor's office. Oh well, I'm gonna get it together because that's another reason why I've been wanting to get a gym membership, is to, do better with my health and, get everything back in shape and all that good stuff. Okay, so keep active. Exercising before and during pregnancy can help protect from developing gestational diabetes. But wait, well, they did say no guarantees. There's no guarantees, so I'll take that. Aim for 30 minutes of moderate activity on most days of the week. Take a brisk walk daily. I guess I'm going to get me a little lady, my little miniature dachshund, outside the house and walk around the neighborhood more often. Short bursts of activities such as parking further away from the store, which I do that anyway. I've been doing that for years. I've always said a little bit goes a long way, and it does. Like, I've been a truck driver for 13 years. 13 years, and I don't work out. I definitely have not worked out through my 13 years of truck driving, and I think I'm in pretty decent shape. We can always do better. We can always do better in everything that we do, but for 13 years of truck driving, come on now. Like, I'm doing good. So I get my time frames where I work out consistently every blue moon. That's about it. But at least I try, and I do. And I do keep my body in motion. Because, most truck drivers, especially those who don't work out on somewhat of a regular basis, we drive and eat. We get out there. And I don't mean out there as in out there to work out. We, flat out. But I'm not worried about it. I ain't stressing it. I'm going to stay with it and I'm going to get on it. Don't gain more weight than recommended. So I guess my doctor is going to let me know. We'll talk about that next week, I guess, at the doctor's appointment. Gaining some weight during pregnancy is typical and healthy, but gaining too much weight too quickly can increase your risk of gestational diabetes. So I've never been the one to watch my weight, but I guess I definitely will now, if that will keep my risk down of all this stuff that I just went over. I will ask my healthcare provider. So, okay, the review. History of PCOS can lead to higher risk for pregnancy complications such as miscarriage, gestational diabetes, preeclampsia, preterm birth, and a C-section deliveries. Wow, I was dyslexic on this part. I spelled deliveries with a B. Yeah, we ain't gonna talk about that. Gestational diabetes is high blood sugar during pregnancy, which usually returns to normal levels soon after delivery. Higher risk for type 2 diabetes, which is the body not responding properly to insulin, and the pancreas may not produce enough insulin. Type 1 is an autoimmune disease that the body attacks the insulin, producing cells in the pancreas, which needs injections. Complications from gestational diabetes that puts the baby at risk are excessive birth weight, preterm delivery, which is delivering the baby early, whether it's natural or through C-section, serious breathing difficulties, hyperglycemia, which is low blood sugar, obesity, and type 2 diabetes later on in life, which I know I can help them avoid that, because I will make sure my baby is active, or they're going to naturally be active, all that darn energy these kids be having. But yeah, we definitely going to be in shape. It's going to help me get in shape, because as they age, we're going to be active. Get them in some sports, run track, do basketball, gymnastics, you know, some stuff that I used to do. And who knows, it may be weird that they would take up and like soccer. I tried to do soccer when I was young. That wasn't for me. That was not for me. It's too much running. I'm a runner, but that's consistent running. I didn't do long distance running in school. No, I'm a sprinter. But we can work with that and work through that. I'm not stressing that part. It's a lot that I'm not stressing, but it's just better to have the information to know what is possible and prepare for than not know it all. Complications from gestational diabetes that puts mom at risk are high blood pressure, preeclampsia, C-section, and future diabetes. We can manage that by staying on top of it, staying ahead. We'll keep it away. Prevention. It's no guarantee to prevent. It's no guarantee to prevention of gestational diabetes, but being healthier prior to pregnant can help. Eat healthier, start at a healthy weight, keep active, and don't gain no more weight than recommended, which I think I can manage that. The conclusion of this video, if you found this video helpful, look, we're going to cut that out. Okay, if you found this video helpful and informative, please click that thumbs up button and don't forget to subscribe, so that way you can be notified when I have upcoming videos, because I have a lot more to come. I believe the next video I will do will be, let's see, which one should I do? Fibroid. We'll go in order, the way I got them written down. So the next video that I will do will be on fibroids, as soon as I do my research on that, because I do have fibroids. That is what my doctor's appointment was for today. Get some imaging done. Did an ultrasound to see what's going on, see if my cyst and my fibroids has gotten better or gotten worse, and it will give the IVF doctor something more to kind of look at to see if I'm, good to go forth with my 2 weeks of treatment and injections and sticking myself with needles so I can have this baby. So yeah, if you found this video informative and interesting and helpful, please hit that thumbs up button. And don't forget to subscribe to my channel. I will be coming out with more videos. Like I said, it's crunch time. We are here. Next week is definitely a big week to see what's going on. So keep me in prayers, me and my husband, our future baby. And we're going to get this done. I know it's going to happen. If there's anything else that you might want me to cover pertaining to me personally, this journey and IVF treatment, please drop it in the comments. Let me know, and I will work on it. Just be patient with me. I'm a truck driver. My life consists of truck driving, but I'm at the end of that. We're getting there. But yes, thank you for watching. Thank you for your time, and I hope you liked it. Especially since I kind of fumbled through a little bit. Like I said, I'm tired, but I'm getting through it. So have a great rest of your day, and I'll catch you later. Deuces.